Well, hello, listeners, and welcome back to Our Experts podcast. I am Carol Matichka, your host, and we like to bring various interesting guests on board, and this is no exception today. I'm very excited to have you with us today.
Okay.
So this is Anessia Ellerson. Anessia, welcome to the show.
Thank you, Carol.
You're very welcome. And I've known you for a little while now through work in the professional organizations because you're very involved.
Absolutely.
And also now you're at Walgreens as well, and we'll get into that in just a little bit. But thank you for joining us, and thank you for promoting pharmacy through the many years of your profession. So with that, we'll go ahead and get started.
Absolutely.
But thank you to all of you for joining us as well. Everyone knows that technicians really are the backbone for pharmacists and for a pharmacy. So I thought it was really important that we brought on a technician who could really talk to that and talk to our audience about what that's like. So tell us a little bit about your background. Tell us about yourself.
Okay. So I am currently a pharmacy operations manager at Walgreens here in Jacksonville, Florida. Previously, I was a travel technician, and I got a chance to work in multiple states. My last state was Pennsylvania. What else? I've been a technician for about 20 years, so that gets glued to my age.
Fantastic. No, you don't.
Gets glued to my
you don't
age.
look it. That's awesome.
That's a good thing.
I gotta get your tips.
Okay. So I've been doing this for quite a bit. Recently, I did apply to pharmacy school, and then I realized that I was more a lobbyist for pharmacy issue. So I applied to law school to start this fall, actually, yes.
Wow. That's great. Fantastic.
Thanks.
Well, that's very exciting. So you are a pharmacy technician, and tell us a little bit about where you work and what you do.
Okay, so I'm a pharmacy operations manager for Walgreens. That kind of entails the operations of pharmacy. So everybody under the pharmacy manager answers to me in the pharmacy. Basically, I'm in control of budget, ordering, what else do we do? Scheduling, anything to do with the operation and the day-to-day operation of the pharmacy, such as our core workflow, making sure everything is moving the way it needs to move. I'm responsible for that.
Oh, fantastic.
Yeah.
So what do you think the biggest challenges are facing technicians today, as well as pharmacy? You could talk about just the profession as well. What are your thoughts on that?
So this is going to sound funny. I tell people all the time, it's the language that's the problem. Like, even looking at legislation with me being active with GAC, Governmental Affairs Committee with FPA, I'm learning that language is everything. It's how it's presented and how it's said. And so that's like a lot of the issues that's going on in pharmacy today. I look at our pharmacists, even in retail, because this is my first around in retail, so I'm pretty new to retail. I noticed that pharmacists in retail are not practicing at the top of their license. They're actually, to me, they digress when they go to retail versus progression taking place, and they get so content. They kind of gain a lackadaisical attitude, like, we're just here, let me just get this out, we're counting pills, let me just consult this patient, and I'm done for the day. And I worry that they don't understand the bigger picture, like consulting, this is where you should be, this is how you should be practicing, you should be in a clinic, you should be operating the clinic fully, and that's, for me, I see the profession going completely different, and I kind of see, I understand why they're using pharmacy technicians as operations manager, because you're trying to get the pharmacists to practice at the top of their field versus having to deal with inventory, something as simple as inventory.
Yeah, I hear you. And I will play a little bit of devil's advocate because you'll hear then pharmacists will also say, well, we'd love to do that, but it's just the time. We don't have the time to do that. So what are your thoughts on that?
So the interaction with the patients are very important. Like, recently, Walgreens changed their model where they're putting the pharmacists more up front so that they're interacting with the patients more. So the patients, because think about it, pharmacists are the most trusted people in healthcare currently.
Yeah.
They trust the pharmacist's judgment more than they trust their doctor's judgment most of the time. And so the first space they should see coming into a pharmacy is the pharmacist. But it kind of takes away from their day-to-day activities. Like they can't get everything completed because they're right there up front, and they can't move past that. And it's like the lines get longer and longer and longer.
Right.
And so it's like, love that part of it. You want to interact with the patients, but let's interact with the patients through medication therapy management, where
which would be great, right?
You know what I'm saying? Let's talk about making sure they're adhering to it and giving them recommendation. Hey, did you talk to your doctor about this? Because this is recommended because I see you're on a atorvastatin or something like that. These are the kind of interactions they should be having versus, oh, can you tell me where to find this at?
Right. Yeah. Trying to find the toilet paper.
Exactly,
something like that.
Yeah, so it's like,
and there's so much we can do as pharmacists.
Yes.
Test and treat.
Everything.
Really, the chronic disease state management, all of that. And so it's like a chicken and the egg, though, trying to figure out what comes first. Can we get pharmacists doing all of this before we alleviate everything else they're having to do? So it becomes this big challenge, right?
Yeah, so it becomes a back and forth type of game, like how much can we get them to do this and how much can we get them to do that? But then that's where it comes, this is where I feel like technicians come in and play a role.
Sure.
That's why they have advanced certifications for technicians, so that compliance, regulatory compliance, that's a certification that a technician can receive, and they can manage the regulatory part of it, alleviating the pharmacist from having to deal with that aspect of it. Technicians can immunize. That's like the best thing ever that happened in the state of Florida. And, I'm grateful that I even had the opportunity to help write that, write letters,
Right,
so it's like, that
that's
was
great.
really a big thing. And so that kind of like takes the pharmacist, oh, I can work on this consultation while you go get this immunization, so it's like, oh, I got this, you got this. I verified this, you can go. You know what I'm saying? So it's like,
Sure.
It helps out a lot. Like, these things are important.
But we also know there's a big technician shortage. That's a big struggle right now as well. And how do we overcome that?
So that's going to be like a complicated type of thing, because you think about it, it's like 17,500 certified technicians in the state of Florida. And that doesn't even account for just the ones that are just registered in the state of Florida, because pay is an issue.
Right.
You can go work at Amazon right here in Jacksonville for $25 an hour, and retail is starting you at $16.50. Do less, know what I'm saying, less responsibility. Right. But we have to figure out a way to turn pharmacy technician into a career versus just a job. So people stop looking at it as a job. It's now a career,
Right.
Something that you can advance in, knowing that their career ladder's there. These things are important in order for them to know, hey, okay, I may start at $16.50, but hey, I'll be an operations manager in less than 10 years. You know what I'm saying?
Sure.
These are my destinations. I could be a pharmacy supervisor in the hospital within this amount of time. So there's somewhere for you to go. So you just don't say, oh, I'm just counting pills on the counter.
Right. And I hear that a lot, too, is why would I get the extra certification? Why would I do this extra work when I could make a lot more money doing something else or going in this direction? So it is a challenge, I would definitely say, for sure.
Yeah.
So COVID was certainly challenging. Still is challenging. It is for pharmacists, but for technicians as well. So talk to us about some of those difficulties that technicians had during that time and continue to have, especially during the peak of the pandemic. Though.
Okay, so during the peak of the pandemic, I was a traveling pharmacy technician.
Oh, wow.
So our job scope expanded. Like, we went from having limitations to this, okay, now you can do this, you can do that. Just being in different states, I'm like, Florida is not as behind as we think we are. There's other states that are further behind with technicians. But we were able to immunize. I got a chance to do COVID clinics. These are like big things that, wait a minute, before we couldn't give shots. Now we're being trained to give immunizations. And now we need to make sure that their blood pressure is okay before we give them. Are you okay? Are you stable before you leave?
Right.
Worried about, we need to be CPR trained. So it's like all these things that we didn't have responsibility of. It truly did burn a lot of technicians out. And a lot of technicians did walk away from the field of pharmacy during COVID. and because it was just so much, and it never stopped,
So it was pluses and minuses.
Yeah,
In
yes.
some ways, there was an advancement,
Yeah.
as well as though all of these extra things are very
Exactly.
challenging.
Yeah, it is.
And I talk to pharmacists, and they say the same thing. It was great, and we were doing all these extra things, and we stayed open when other places did not, which was good and bad
Exactly.
too. So it was a very challenging time, and I think continues to. Well, we've seen some of the fallout from that for sure. So you've seen a lot of changes over the years. You said you've been a technician for 20 years. That is awesome. That's amazing, actually. So what are some of the greatest triumphs that you have seen, and some that you've advocated for, which you mentioned one of them?
So immunizations was one of my big ones. And I was shocked that it actually, at first it was just temporary with HHS thing from the government. And then all of a sudden it's like now we can do this all the time. It never changes. So that was like a big thing. And I remember Dr. Baldwin always, hey, Nisha, did you look at it? What did you find that was new? And you're sending a spreadsheet to Burton. Is it Representative Burton?
Yeah. You see, remember,
So Representative Burton, you're like, oh my God, are they going to let it go through? You're crossing your fingers. You're doing all these things. Like, are they going to let it go through? And what does that mean for us? Does that mean a pay increase? Like you're thinking about all these things. You're like, is that a pay increase, or is this going to happen? And then when I was out in Iowa, because during the pandemic, that's when TPV became a big thing, technician product verification. Mm-hmm. And then I got a chance to see it firsthand out in Iowa, and I'm like, oh, wow, so that's how it actually works, And
tell people what that is.
So technician product verification means that a technician is verifying the final product. So basically, the orders are being put in by a pharmacist, and the pharmacist is doing the data side of it. And then when the product is ready to go, it's being verified by another pharmacy technician. And at first in my head, I was like, how does that work? What's the error rate? And apparently the error rate was like the same. It didn't change. The only thing that had to be double checked again was that order. Was the order entered correctly? Mm-hmm. And that was the only thing that I always thought, wait a minute, where's the pharmacist? You have that moment like, where's the pharmacist? But then it's like, okay, this is what the order say. You're checking it off. Everything matches. This is how it would go if it was in the regular, a pharmacist standing right there to check it off, and it's gone. And so that was very different for me.
Sure.
It was very different. But I was confident because the technicians were advanced certified. Like, they were not just regular technicians. They had advanced certifications. They had TPV. Some of them had associates in pharmacy services. I'm not really sure what that is.
Interesting.
So there is a program like that. University of Maryland offers a program for technicians to get their AS, Associates of Science. So some
of our listeners might know it as Tech Check Tech.
Yeah.
You've heard that before.
Yeah,
I
think it's the same thing. Arizona had it, but Arizona's had it for a long time. Mm-hmm. So it's like it's not new to them, but they really utilized it during the COVID pandemic.
And these are things we really need to be talking about more. We talk about pharmacists want to be able to do all of these services and do what they're trained to do, but I think there's a lot of pharmacists who are nervous about letting certain things go as well. Do you find that when you're talking to pharmacists?
I find that not so much with the younger pharmacists that are trying to move into consulting and they want to be on that side of it. I find it more like with our middle, because that's what a generational thing is, because older pharmacists they're so used to the way things used to be.
Absolutely. Right.
And so it's hard to change, and it's like, okay, how do I relinquish that control and still be confident that the team that I've trained is going to efficiently deliver the same thing, whether I'm there or not. And so I talk about my pharmacist, Dr. Johnson, who I work with now. She confidently says, I know that my technicians have it. She said, I can go on vacation for 2 weeks and nothing will change. My numbers won't change. And that's how confident she is with her team. Yeah. And that's how I feel like the pharmacist has to become, knowing that all my technicians are certified. You know what I'm saying? So just knowing that they're striving for a goal and they see the bigger picture, that for me, patient safety is the most important thing. If it's going to compromise the integrity of what the patient receives. Me too, because I'm a technician too, and I get my medication filled.
Right, of course, yeah.
So we do the
We're
same
all
thing.
Patients,
so it's more like, okay, what's the difference between an advanced certified technician and a regular technician? An advanced certified technician is vested.
Interesting.
They're vested.
Right.
Certified technicians are vested. These are technicians that have put time into their career, and they know this is where they're going to stay. They're not here because it's just a job. It's more of a career for them, and they're trying to figure out how they can go further without having to switch fields.
Right. Wow, that's very insightful. Thank you for that information. And so let's talk about maybe an ideal work environment for a technician. So what do you think that would look like? And what do you think the perfect pharmacist looks like to help supporting that pharmacy technician? We'll just throw that out there.
Okay. I must say I've always worked with pretty great, like, I've worked with great pharmacists. So I'm trying to think of like a pharmacist that's not ideal because.
And we won't talk about those.
Okay, so I got all these ideal pharmacists. I'm like, I can think of like a lot of them,
That's
Dr.
great.
Simone, who used to be here.
Oh, absolutely.
Katie was like a dynamic pharmacist.
She graduated from the Jax campus.
Yeah. Dr. Nisha, she's great, you know.
Yeah.
So I'm like, I'm starting to think, I'm like, all these pharmacists I work with, like Petra over at Baptist, she's great. Dr. Tucker, so I've worked
all
with
these Jax grads. This
yeah,
is
so
fantastic.
I've worked with so many great pharmacists. I'm like, and even now I have Dr. Maya. She's from FAMU. She's newer. She's like out of school a year and a half. I have her, and I have.
And so, what makes them so great?
Maya is efficient. Like, she knows the law. Like, to me, she knows the law. She didn't know about consulting, but now she's a consultant pharmacist, so she's migrating up. But she pays attention to detail. Like Nicole Sessler, well, Dr. Lindsay now, she's not Sessler anymore, but Dr. Lindsay, she paid attention to detail. She's detail-oriented. How this, and this. I'm like, for me, an efficient pharmacy runs based upon how efficient the pharmacist is. Did you pay attention to this detail? Did you notice this? Did you check this? Like, these are like the checkpoints in my head for a perfect pharmacist because and
that makes sense. You're in pharmacy operations. You want to see it running efficiently and flowing.
But that's how I've always been. Like, I'm one of those people that, like, if it's supported in a policy, I'm going to follow it to the letter.
Gotcha.
So I'm a policy person. So my perfect pharmacist is a policy person.
So what about that pharmacist who's real compassionate, brings the patients back? They enjoy talking to their pharmacist.
So I enjoy those pharmacists too. They're great, and Maya and them all have that personality too. All of them have that great personality to make patients want to come back. However, I'm also a numbers person, so we pay attention to numbers. I'm a numbers person too. So if the company is promoting that, that's what I'm promoting. They want the pharmacist to be right there talking to the patients, but they also want their workflow to continue.
Right.
So it has to be a healthy balance, and that's where you come with my ideal team of technicians, efficient technicians that are constantly, hey, excuse me, when you get a moment, can you come? I have this ready for you. We need to get this cleared off. Can you clear this off? And I'll help up front. This is my ideal workflow of how it works. Like, this is the team I want to work with. You know what I'm saying? They know when we need to stop and pause. They know when we can you know what I'm saying? But they also know that, hey, we have bottom lines that we have to meet too.
Right. Gotcha.
Yeah.
All right. Well, thank you. So what are some of the issues today that you're advocating for? I know you're very involved with professional organizations. So what are you advocating for? You've kind of mentioned a little bit, but. So
currently I'm advocating for a couple things. The first thing is language. And I know everybody's like, what does that mean? What does that mean? In a lot of conversations that I have, even in professional environments, technicians sometimes are an afterthought. Like, sometimes they forget to get mentioned in the conversation. And I'm like, it should always be pharmacist, technician, pharmacy student. It should just be our conversation that we always remember to mention the technicians there too, because they're already professionals. They're not doctor version of it, but they are professionals. Pharmacy technician is a profession that they have. And for me, I'm advocating for people to remember that, because a dental hygienist is always remembered by their dentist as the next person. They talk about their students, but they don't talk about their students until after the dental hygienist. It's just a simple thing. And it sounds like it's big, but it's not. It's more like in the conversation, well, hi, I got Dr. Carol, and I have Anessia, the pharmacy technician. And then we have a couple of students that work with us also, because I'll be honest with you, I know a lot of students that didn't make it, you know. And then technicians are looking like, oh, you forgot about me, you know, and it's not nice to be forgotten.
No, everybody wants to be included.
Exactly. So
right.
For me, being in a professional organization, like I'm advocating for certification for all technicians. You talk about technician reciprocity, right? Mm-hmm. So, and that's supposed to be a part of the bigger healthcare package for the state of Florida. Right. But not saying it's not going to be called reciprocity, but ultimately that's what it is. Ultimately, that's what it is. Right. But we're going to say technicians coming into the state of Florida have to be nationally certified. But then here's my question is, what about the technicians that's already in the state of Florida that are operating and not nationally certified? That kind of changes the dynamics of everybody, because now you're saying, oh, we mandated from people coming out of state. What about the technicians coming in state that's already here that are just...
Yeah, and that'll be interesting. Yeah. We already have a shortage, so how do you manage that?
Exactly. Yeah. So I'm like, I'm looking to see what the outcome of that is, because I've always been for national certification. I think is a good thing. It helps, bring a level of competency to the position where you're not just a pill counter. You could be an IV tech. You're anything. You're a chemo tech. It's so many different positions as a pharmacy technician. But what makes you different? What distinguishes you between a regular technician and a great technician?
No, I love that. Thank you. Yeah. So where do you see then technicians 10 years from now? We're looking in our glass ball.
Well, advocating. I see my pharmacists, because if nothing changes for the pharmacists, nothing's going to change for technicians. Yeah. So I see my pharmacists being paid for their services. Sure. And now they are able to do more hands-on test and treat. And I actually see in the future technicians doing the day-to-day operations of the pharmacy, while the pharmacist is doing everything else outside of it.
Well, there you go. And I don't think you're alone in that vision. Yeah. Like, I really see an evolution in regards to community pharmacy and where we'll see things go. So
absolutely.
So you've certainly, as we mentioned, have been extremely involved in professional organizations, which is great. And I've heard from technicians as well as pharmacists that they don't really understand the benefit of joining a pharmacy organization. So I want you, as a technician, to explain why that's so important and what it's meant to you in your life.
Okay. So have you ever seen a technician go up against the board of pharmacy?
I think I have once. Yeah.
And have you ever noticed that there's never anybody there directly
advocating? Oh, I see
advocating?
What you're saying. I got your question. Yes, I've seen that a lot of times, actually.
Yeah. Okay. And you see that they normally don't have anyone advocating for them?
Absolutely.
And so what I've learned, the benefit of connecting, because FPA, FSHP is a connection thing. Sure. It's like you're connecting with others who are in the profession and share the same dreams and hopes, right? Mm-hmm. So when I think about why you should be in a professional organization, my favorite quote is, be the change you want to see. So in order for it to change, you have to be the first person to actually take a step. The first step is professional organizations offer professional development. They're there to advocate on your behalf. When things are not going right, you can bring the issue to them, and they'll bring it to their team, and they'll look at it, and they'll advocate for you. So you need someone that can advocate for you. So professional organizations are out there to advocate for pharmacists, pharmacy technicians, and pharmacy students. If you're not a member, then you don't know the active things that they're doing out there. They're out there advocating at the Capitol. They're up at D.C. They're fighting for the rights that you want to see. And as they fight for you, they're developing you, and they're trying to create more things so that you can grow further into your profession. So I say, why not be a member of FPA? Why not be a member of FSHP? Why not be a member of AHHP? It's so many organizations. So it's like you can't miss it. It's like, and then they're like, oh, they don't care about you. They do care about you. They care about your issues, but they don't know all the issues because it hasn't been presented to them. Exactly. And so if I don't know what your issue is, I don't know what I'm advocating for, even though I'm a technician, my issues in retail may be different than your issues in hospital.
Sure.
So being a member of these organizations keeps you up to date on what's going on in your profession, what's going on in your state. These are things that are important. And even now, I'm thinking about like upcoming annual events. June, even for FSHP in August. Professional development, how to interview. You learn all these things in professional organizations. They provide these classes for you. They're there for workshops. They're there to help you develop in management and take you further in your career. So they're actually there to actually promote the profession and make you better.
And really, that networking is so huge at all these organizational annual meetings, but any of the meetings.
Exactly.
And I don't think people understand the power of knowing people and getting to know people.
Exactly.
It's such an important thing.
It changes everything.
Absolutely. And it's such a great skill as well to be able to interact and talk.
Exactly.
So I couldn't agree with you more. So is there anything else that you want to leave us with today? I don't know if I left anything out. You've said a lot, and it's been extremely insightful and helpful.
Okay. So I'm looking to work with some of our leadership here at FPA to start a technician academy where we can develop technicians professionally and, teaching them the simple things. Some technicians don't know the difference between a resume and a CV. What's the difference?
Right.
How do you promote yourself when you're trying to go for management versus just going as a regular technician, So these are things that I think a Technician Academy would bring to the state of Florida, not just to Jacksonville, not just to Tallahassee, but everywhere, to the whole state. How can we help you to become greater? So Technician Academy is something that I think would actually help a lot.
That's fascinating. Yeah. So you said that's going to be with FPA.
FPA.
Does FSHP also have an academy? At
No,
this
they
point?
don't. They do, but they do.
Yeah.
I am the immediate past chair for the Technician Council there.
Okay.
And I'm still very actively involved with FSHP. I actually I'm the technician liaison for the Education Council, so I help plan the technician tracks that they have during their annual meeting, which is really great, and it's an eye-opener because it teaches you how to get something accredited, what it takes to get it passed for the state of Florida in order for it to meet the standards for all your certifications and your license. So
Right. Yeah. And people don't realize there's different objectives for pharmacy technicians than pharmacists in all of those meetings,
exactly.
which is very important. They make sure that they meet all of the requirements and what each profession needs as well.
Exactly. So
yeah, absolutely.
That's a big deal. I can't think of ASHP has the new Technician Society, which is pretty awesome. Which is pretty awesome. And, but I always tell people start in your state, because you have to change your state before you can change the world.
I completely agree. People don't understand how important the state is. So much happens through the state with the laws, much more than nationally.
Yeah, so they don't understand that, you got to change your state before you can change nationally, because it may change nationally, but your state has to get on board too, so you have to change the state first.
Absolutely. Well, this is fantastic. Thank you for sharing so much today with our listeners. I really appreciate you coming on. Everyone, this is Anessia. And if they want to get a hold of you, is that possible?
Absolutely.
Maybe we could leave something in the show notes for them.
Absolutely. I'm pretty much open and available with questions.
Maybe an email address.
Exactly.
Or something.
Absolutely.
Okay.
Absolutely.
We'll put that in there.
Okay.
Well, thank you. And we really appreciate everyone who has really supported our podcast as well as the YouTube channel. So to support us even more, go ahead and subscribe to those and follow us. We really appreciate it, and we'll see you next time.
Thank you.
Thank you.